All right, class. So we are going to lecture over chapter 10, which is microbiology. This is Miss Rachel. All right. So there are several individuals who made contributions to the field of microbiology. Each of their discoveries made an impact on their approach to the identification and treatment of different diseases. There are two things you will see in your book. There are two people listed as the quote unquote father of microbiology. On this slide, it goes into it a little bit. Anton van Leeuwenhoek. That is the first one that they're mentioning as the father of microbiology, but on the questions on the test, you were going to list Louis Pasteur, okay, which we'll see on the next slide. But Anton Leeuwenhoek was the first one. He saw moving microorganisms for the first time through a magnifying glass. He was the first person to ever record these microscopic findings. Ferdinand Julius Cohen classified bacteria as plants. He studied this life cycle of bacillus and has become very critical in today's sterilization procedure. He was the first one to identify that bacteria or divided bacteria into 4 different groups. This is Louis Pasteur. This is the one I was talking about. On the test, it'll say who is the father of microbiology. This is the one you need to mark for that. They were both listed as that, but I'm pretty sure I fixed the questions the way they show up. So, but Louis Pasteur founded that bacteria can be destroyed by heat. So that's how we come up with the process of sterilization, by knowing that we can destroy it. The food canning process was developed with his help, but in dental offices, sterilizers are based on that same concept, is heat will destroy the pathogens. He went on to help with the foundation for vaccines, for a lot of them that were produced. So this goes way back in the day. So there were two people, Anton van Leeuwenhoek and also Louis Pasteur was given the title of father of microbiology. So while they were both titled that, when it comes to the tests, you're going to choose Louis Pasteur. So when a specific bacteria, we're going to talk about Robert Koch, when a specific bacteria causes a specific disease, this is termed the etiologic agent. What this means is the origin of that. Robert Koch proved that there's a causative agent of each disease. So they all have an etiologic agent. He found it that the etiologic agent for tuberculosis, he noticed that. And the Koch's postulates is a procedure, which we need to be aware of. And that's in your book. You can read more on that. The Koch's postulates is a procedure that was developed to prove that bacterium was the cause of a disease. So this is just a little history lesson to kind of figure out how we got to where we are. Richard Julius Petrie founded and discovered the Petri dish. I'm sure you all probably know what that is, but let me show you a picture real quick. Petri dishes look like this usually, have the red jelly-like substance on the inside, which is completely sterile. Then they put a swab all over it, and then they will put it into a container and allow it to grow to see what type of bacteria is present. It looks something like this. The bacteria will grow on whatever pattern is swiped on it. So if you just dab it, it'll look like a circle. If you zigzag it, it's going to look like a zigzag, which I think is pretty cool. This has always interested me. I remember looking at this in like 2nd or 3rd grade science class, and I was just fascinated by it. sorry, let me get back to my PowerPoint here. All right. So he also further developed the technique for dispensing bacteria onto the medium. So there's several different methods that you can do to culture that bacteria for research. But this lid can be easily removed off of the Petri dish, which is still, I mean, we're still using the same thing that was developed all those years ago. So it's pretty awesome. Bacteria and microorganisms have different shapes. They look different. So to distinguish the different bacteria groups, and Dr. Christian developed the staining procedure, and this is called the Gram stain. So this will differentiate the cell into two specific groups, either gram positive or gram negative. When we're doing a gram stain, let me show a video, but if it pops up as dark, if the bacteria keeps their dark purple color, they are gram positive. If they lose their color, they are gram negative. If it's inconsistent, it's a variable. So I want to find a video that I showed real quick on gram testing. Give me 1 second here. All right, here's this. This is how we do the gram stain procedure. Okay, so gram-positive bacteria stain purple because of the thick I can't ever say this word, peptidoglycan layer, which retains the crystal violet iodine complex. So by this, it looks like this is gram-positive. Gram-negative bacteria appear pink because they have thin peptidoglycan layer, which does not retain crystal violet, but is stained by the safranin. So this one's gram-negative. Pretty cool. And then you would have a mixture of both of those if it was going to be a sorry, 1 second. Let me get back to my slide here. if it's going to be a gram variable. I'm not sure why it moved to the next slide. So I thought that was pretty cool because it's a whole process and it picks up different stains based on the thickness of that word that I can't say. Okay, so bacteria can form with or without oxygen, but they have two different words for it. An aerobic bacteria has to have oxygen to grow and live. So I think of this as like if you're doing aerobic exercise, it's going to make you breathe more, so you need more oxygen. So aerobic is like an aerobic, heavy breathing exercise, lots of oxygen. Anaerobic is the opposite. Bacterias are destroyed in the presence of oxygen, meaning they cannot survive or without anaerobic bacteria. So if you're breaking down the words, the anaerobic, so you just have to read it carefully. Facultative anaerobic bacteria grow with or without oxygen, so it doesn't matter. I would think those would be the most dangerous type because they can just grow in every setting and it doesn't really matter. So facultative, I always struggle with those words, guys. It's so horrible. It's hard to say for me. Okay, so signs of tuberculosis may not show up for several months. This is found in the lungs and it's caused by something called Microbacterium tuberculosis. It's important for us as dental assistants and dental personnel to wear a mask during your procedures, especially right now during COVID, but also to protect yourself from any spray that any aerosols or spray that the handpiece might put up into your face, so we can protect ourselves. Treatment, you can treat tuberculosis, but it's usually by antibiotic or other drugs, and you guys will be tested for tuberculosis if you haven't been already. It's just a tiny little amount they put under the skin fluid, and they can tell by how it responds. So you get that, and then within 24 to 48 hours, you come back to have it read, quote unquote, read by a nurse, meaning it's either positive or negative. So sometimes if you've ever been exposed to it or if you've ever had it, you'll probably always test positive, and then you just have to go get an x-ray and have your lungs checked to make sure that there's nothing active going on. But with tuberculosis, it is bacteria that's found in the lungs. Some of the symptoms are fatigue, fever, weight loss, and persistent cough. It's a very gnarly cough. It's not just kind of like a little one, but it's persistent cough. It is very much airborne. A lot of things that we get from other people, a lot of it is airborne. And I know right now we're all probably a little gun shy or nervous about things being airborne, but that's just how things are transferred from person to person. But dental professionals must wear a mask when we're working. Again, this is a little outdated because of COVID, so everybody's wearing masks, but you definitely have to protect yourself. Like I mentioned before, it's detected by a skin test or a chest x-ray, and it's treated with antibiotics or other drugs. Legionellosis is a gram-negative bacteria. It's also an aerobic bacteria. It's transmitted through droplets. So when we cough or sneeze or anything that comes from our lungs in an aerosol droplet. And this is often associated with hotels and cruise ships and hospitals or older cooling systems. They used to have something called swamp coolers. Well, we have quite a few of them here in Denver, but in Texas, they used to have swamp coolers, which didn't work that great because Texas is hot and humid. But it would definitely have that bacteria in there. Diphtheria and pertussis, which is whooping cough. Pertussis is whooping cough. We vaccinate for that now, okay? But it doesn't mean that you can't get it. Just because you have a vaccine doesn't mean you can't get whatever it is. You're being vaccinated. So if you do come across it and if you are met with that bacteria, your body will know how to fight it off. So symptoms of diphtheria is a severe throat infection and a fever. Pertussis is a respiratory disease, and this is what's called whooping cough. It usually affects infants and young children. I don't know if any of you have ever had a child with whooping cough, but I want to show a video of what it sounds like because it's like no other cough you've ever heard. Okay, one of my friends had her child actually died from whooping cough, basically suffocated because it couldn't get enough oxygen. and it came on very suddenly. So I just want to show you this video real quick so you could be able to hear what this cough sounds like.
Are you being shy?
21-month-old Pedro Escueda's symptoms started out like those of a typical cold.
He had a little runny nose and started having a little cough.
But over the next 4 to 5 days, Pedro's mom, Chelsea, says the cough got much worse.
It was nothing I've ever heard before. He was coughing and doing the whoop. He'd vomit.
And he couldn't catch his breath. When they took Pedro to the
It's that barking noise. It cough, 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 and then like that. That's what it sounds like.
doctor, the coughing had subsided, so they figured maybe it was just a cold or some other infection. But Chelsea knew there was something else wrong. So the next time Pedro had a coughing fit, her husband got it on video. A nurse practitioner saw it and diagnosed it right away.
And she saw it, she goes, that's pertussis.
Whooping cough is also known as pertussis. It's caused by a bacteria infection that is spread from one person with whooping cough to another person.
What is he doing?
Dr. Thomas Boyce says whooping cough is particularly tough on kids younger than Pedro, who haven't had the full course of vaccinations given at 2, 4, and 6 months.
They're particularly susceptible to getting infection, and because of their small airway, they're particularly susceptible to having very severe disease.
You see, the infection happens in the airway or trachea. The pertussis bacteria produce toxins that irritate and inflame the airway. This causes the severe, repeated cough that lasts for months.
They call it the 100-day cough.
Pedro and his entire family took antibiotics to treat the infection and prevent further spread. Now he's back to health after months of illness. For Medical Edge, I'm Vivian Williams.
So good thing he's okay, but that can be very dangerous. So we do give immunizations for this for children. So it's good. It doesn't, we don't see this very often, but sometimes it happens. So they're given their first immunization for this at 6 months, and then again at 2 years, and then again at 4 years, just to make sure, it's like boosters basically. After their 4-year shot, tetanus boosters are given every 10 years after the age of 5. Okay, so tetanus, what is this? It's a stiffness of lockjaw. Stiffness of the jaw, also known as lockjaw. So strep throat, I'm kind of going all over the place here, but strep throat is caused by the Streptococcus microorganism, and it's been implicated in dental caries and endocarditis. Tetanus, though, some of the signs are they're like very tenderness in their jaw. This is what you've heard of before. People will say, oh, I have lockjaw, I have this or I have that. This usually can happen after like an exposure to a rusty nail or anything like that. So if you ever step on a nail or metal of some sort and it pierces the skin and you're not up to date on your tetanus vaccine, like it talked about, we give tetanus updates every 10 years, then you need to get a tetanus shot to avoid having this problem of the lockjaw. So sorry, I skipped all over the place. I was looking at the next slide, not the one we were on. So strep throat is caused by, like I said, the Streptococcus microorganism. Usually to avoid this, we can give prophylactic regimen to avoid the endocarditis. So you give that as a pre-medication. A lot of times, some people are higher risk and they have to have pre-meds before any appointments are done or they've had any dental visits at all. Strep throat is very common. Symptoms are sore throat, fever, and general malaise. Strep is not only strep throat. It comes in different forms as well, and it can be very dangerous. So we have to watch for symptoms in general and make sure that it's not coming in a different form. Staphylococcal infections, or a staph infection. The first way that we treat this, this particular bacteria will grow in clusters. And the first line of treatment is definitely antibiotics. So this staph infection comes in a lot of different forms. We have just the staph infection. We have gangrene. As women, we know what this is, but toxic shock syndrome, venereal disease, and then also some forms of pneumonia are from the same bacteria. So staph grows in clusters. Anthrax can be fatal if it's not treated before these symptoms manifest. I know some of you are probably old enough to remember this, but the scare of the anthrax that was getting sent to the White House. I think that was during President Bush's term, or it could have been during President Clinton. I don't remember which one it was, but I remember that there was a huge scare where people were coding letters in it. And there was a white powder form all over letters and stuff that were reaching different parts of the White House. And so when they would open it, they would touch it, and then they might touch their mouth or their eyes or something, and it would get in through their skin. So anthrax can be enter the body through the cuts in the skin or in eating diseased meat, it says, but diseased food, or it entering in your mouth. Symptoms will show within 1 to 6 days. Those symptoms are fever, weakness, and dry hacking cough, which as adults, we always know if we get these symptoms, we just kind of see if our body's going to, deal with it on their own. But that's the hard part, is we need to make sure that if we've been exposed to anthrax, that we are treating it before the symptoms manifest. Otherwise, it's going to be a big problem. Chlamydia has many different infections. They can be treated successfully and quickly, usually with antibiotics like tetracycline or erythromycin if you're allergic to penicillin. Tetracycline is that medicine that they used to give if a woman is pregnant, and that they take the medicine when the teeth are developing. It can leave permanent staining on there. But chlamydia, microorganisms are somewhere between bacteria and viruses, so in size, so they're very small. Chlamydia will infect the genitals, the eyes, the lymph nodes. It is the most common and sexually transmitted disease in the US, and we obviously use antibiotics for this now. MRSA or MRSA, you'll hear some people refer to that. MRSA is a bacteria that is resistant to commonly used antibiotics. This is usually passed by direct contact. And then you can be a carrier of MRSA, but have no clue that you have it. So for example, my mom has been fine. It's never been a problem, but she went in for her hip replacement, and they always do a test. Because anytime you're opening up a joint and doing a joint replacement, you want to make sure that you don't have any active infections going on. But she did have signs of that infection in her nasal swab, but she was completely fine. Like there was nothing wrong with her. Like she didn't have a fever, she didn't have anything. So she was a carrier at that point. But they also mentioned that it could be from like nasal cannulas with oxygen and other things in that manner that she could have come in contact with. So, but it's, again, there's no problem. She had to take some antibiotics after her hip replacement, some pretty gnarly ones. So which shapes in bacteria, the different shapes of bacteria. Okay, there's several different ones, and it breaks it down for you in the book. Okay, so bacilli, those are rod shaped. Cocci are round or bead shaped. Inspirilia are S-shaped, and Vibrios are curved. So I'm not sure how to tell you how to study for that part of it. You just kind of have to know which ones are which. These are on the test. So I highly suggest you make some flashcards or something. And Spirilia, it would be easy. It's S-shaped, starts with an S. So that's easy. I don't know how to help you remember the other ones. There's no trick that I've found for those. You just kind of got to memorize it. Protozoa. This is often called amoeba. These are only 100 microns in size. They will reproduce by binary fission and can be found in fluids in the bloodstream, mouth, intestinal tract, and survive in polluted waters and ponds. So we work in the mouth constantly. So that's why we have to learn about these, is we have to be aware of what we're being exposed to. Protozoa is just below the visibility of the naked eye in order, like we can't just see it, obviously. So it's fairly large. As far as bacteria goes, it's always dividing and changing shape. And they have flagella, which whip around and cause extra movement. So these are like thread-like appendages, like arms kind of, that helps them navigate and move, which is kind of weird. Kind of weird. Okay, amoebic dysentery is caused by the microorganism of Entamoeba histolica. These have to be treated with drugs, otherwise it won't go away. This causes severe diarrhea, and it can cause abscesses in the liver, which you might hear of dysentery if people get this if they travel to other countries where they don't treat their water like we do. If they don't treat their water at all, or not as much, you're just not used to it. So anytime you travel to a foreign country, you need to make sure you stick to drinking bottled water while you're there if you don't want to get dysentery. And let me just tell you, I went to Mexico once, a long time ago, and I did not drink the water, but I used it to rinse my toothbrush. And just that very little bit had me struggling, let me tell you. It is not fun, and it lasted for quite a while. You don't want to do that on your vacation. So periodontal disease is a protozoa and a bacteria. This is found in inflamed tissues around the tooth. And that's what we call in the sulcus, or in that area. Protozoa is found in the plaque in the periodontal pockets. So deep, that tissue where you're measuring and you might get a deep pocket, you're going to have protozoa in there. And remember, that's just below the visibility of the naked eye. So still quite large, but we're fighting those bacteria. So we have to remove it, clean it, disinfect it as much as we can, and keep up with the oral hygiene. Educate our patients and let them know that we are getting rid of this bacteria that's causing this bone loss. Malaria, I know we've heard of this. The symptoms pop up during the first 2 weeks. There's fever and soreness at the point of entry. I believe this is transmitted by mosquito bites. And the testy fly. We have to use drugs to kill these parasites that malaria is. This is caused by protozoa. So protozoa and malaria and sleeping sickness, all caused the same way. Rickets. Parasites cannot live outside the host. So for example, lice, fleas, ticks, mites, all of these transmit the disease to humans, and rickets can only multiply in the cells of another life form. When the host is dead, the disease then can be, when it's in the host, the disease can then be transmitted to humans. So if you get bit by one of these things, you get rickets. You don't hear that too much anymore. I heard about it when I was a kid a couple of times, but I haven't heard about it since as an adult. Head lice. So these are tiny, tiny little blood-sucking, wingless parasites that can be transmitted through direct contact. I know we all kind of are aware of what lice are, especially if you have any kids and they go to daycare or anything. But when it's infected with head lice, it's called pediculosis. You have to wash everything in super hot water, comb out the hair really well, get rid of it, medicated shampoo, get new brushes. I mean, they say clean the bedding, brushes, and all of that with very, very, very hot water, because that will kill them. But it's hard. I'm thankful that we have not yet experienced that with our children. I think I only was treated one time as a kid, and that was out of precaution. But I don't recall it after that. Rocky Mountain spotted fever. This is rare, but definitely curable. The small pink dots will appear on the skin. This is spreaded again by a host and treated with antibiotics. Typhus is very similar to Rocky Mountain spotted fever. The symptoms are a little bit different: severe headache, back pain, limb pain, constipation, rash, and confusion, which those are pretty specific symptoms, so it helps you identify it a little bit more. Yeast and molds. This is a group of microorganisms that's a little bit smaller than protozoa and larger than just regular bacteria. They're a low form of plant life that hacks chlorophyll in the plants, and then they reproduce by budding, so giving, blooms, basically. Yeast and molds will not be killed or cannot be killed with bacterial antibiotics. Some of you might have heard of candidiasis. I always struggle with this. Candidiasis. This is another infection that's caused by a fungus. The infection is either like thrush with little kiddos. You've probably heard of that heavy white substance that covers the mouth. You can see it in the picture there on the slide. Normally our bodies will keep this at bay, but sometimes when our what's called flora is compromised, the entire immune system is destroyed by antibiotics, the fungi will multiply and overgrow. So it'll just like flourish in these when our immune system is destroyed. Normally you can treat this with antibiotics though. Tinea is a common fungal infection that's acquired from another infected person, animal, or an object, like a shower stall. This happens, it gets on your feet, can be on different parts of your skin, just depends on what you touched with that area. It's like athlete's foot, ringworm, there's a few different versions of it you can see listed there. White patches on the toe or fingernail. So this is why you always want to make sure you're wearing shower shoes or something if you're showering at the gym or walking around with somewhere that doesn't have clean areas. Reading all this can kind of make people become a little OCD, I think, or a hypochondriac. There's just a lot of stuff out there. And if you really think about it when you're going about your day-to-day, you're going to become paranoid, but you do need to know just in case you do come in contact with this stuff. Prions, you can see there it's pronounced like that, prion. This is a host protein that converts a normal protein into abnormal structures. So the abnormal structures then allow it to transform into something called a TSE. TSEs, which stands for transmittable spongiform encephalopathy. So this affects the brain tissue. For example, mad cow disease or bovine spongiform. This is going to affect the nerve cells of an individual, which leads to the loss of brain function. So mad cow disease. You guys have probably heard of that before. Let me find a video for that. So this video is from 2012, so it's been a while. We don't really have this happen a whole lot anymore, but I wanted to show you it a little bit.
Cow disease in this country. Today, the Department of Agriculture confirmed a new case of mad cow in California. It has been 6 years since the last scare, and a lot of precautions were taken then. So how did this cow get sick, and how dangerous is this development? ABC's David Wright has the latest.
Rarely does the health of a single cow have billion-dollar implications, but in this case it does, because it's America's first confirmed case of bovine spongiform encephalitis in 6 years. BSE is mad cow disease, a potentially deadly brain-wasting infection that can be transferred to humans.
The animal was a dairy cow from the state of California. Our laboratory confirmed the findings.
Today, the chief veterinary officer for the USDA cautioned this is an isolated case, not the start of an epidemic.
Our livestock population is some of the healthiest in the world, and the consumers should be confident in our food supply.
Everyone still remembers the devastating outbreak of mad cow disease in Britain during the 90s. 150 people died. After the first case of mad cow disease was confirmed in this country in 2003, dozens of countries banned U.S. beef. Shipments dropped more than 80%. China still bans U.S. beef imports. Today, the USDA insisted this fourth confirmed case occurred at a rendering plant for products other than food.
This particular animal did not enter the food supply at any time, so there is no concern about that.
But the USDA currently tests only 40,000 cows a year of the millions that are slaughtered.
USDA has not completed their investigation of this particular case, and so we'll be watching carefully to see what they find. Obviously, if it turns out that we have tainted feed, we will have a much larger problem on our hands.
Now, it is a mystery how this cow in Hanford, California, contracted the disease. Apparently, it was not from tainted feed, which had been the source of previous outbreaks, but the FDA and the USDA will be testing the feed supply anyway, Diane.
And the government advice to consumers, David?
Well, they say that the beef is safe. Don't forget the burgers and the steaks off the grill at this point. However, food safety.
Okay, I think we understand that. So there's only about 200 cases a year in America. But that for the next one, the Creutzfeldt-Jacobs disease. But this is also fatal. It's very similar to that, but the disease is related to the prion protein, so it kind of falls in that same category. So viruses have to live inside a host or they will not survive. Viruses are only a 1/100th the size of a regular bacteria, and the particles are the smallest known microorganism to date. So there could be other things that we don't know yet, but as of right now, that's it. Viruses are not, they don't respond or are not killed by antibiotics, and we try to just ease the symptoms until it'll pass. So what diseases are caused by viruses? So measles and mumps, there's a 9 to 10 day incubation period before you start seeing symptoms. So it's kind of similar to COVID where it's, 10 days to 2 weeks, I guess. But we vaccinate for MMR, which is measles, mumps, rubella, and it's very, very effective for long-lasting immunity. So we just treat the symptoms with, fever and lotion if there's any itching, because these, you can still get it even if you get vaccinated. Again, vaccines are never to get rid of it or avoid people from getting it altogether. They're like, oh, I was vaccinated for it, so I shouldn't get sick. No, it's to help your body develop immunities to it, meaning your body you'll have antibodies that will help fight it if you were to be infected by it. Know this one, sorry. Swelling of the parotid or salivary glands on one or both sides is the mumps. This is on the test. Know that. So the incubation time for rubella infections is the same. So rubella or German measles, is indicated by a rash on the face, can spread to the trunk and the limbs, but it's only serious if it affects women in the early stages of pregnancy because it can cause birth defects. Again, we vaccinate for this. Epstein-Barr in West Nile. This was discovered, the vaccines were discovered for this virus in the 50s. So there's been a very few cases of this since. We have a West Nile virus, which is transmitted through mosquito bites, and it's usually seasonal. I've never heard of anyone that has Epstein-Barr infection, but I know it can happen, and it's pretty dangerous. Pretty dangerous. Polio, I know we've all heard of that as well. It's not eradicated, but it doesn't happen that much in the United States anymore. This will attack the central nervous system. I know you guys have probably seen or heard of polio before, but I want to show you what happens. Give me 1 second. There's one man, I believe, that's still he's still alive that contracted polio as a kid. And I want to show you this video of that because it's amazing.
Some lawyers have their greatest moments in the courtroom, but for the attorney you're about to meet, every moment of his life has been a feat. He's among a tiny number of people in America who still rely on an iron lung to breathe, but it has not held him back. Jobin Paniker shows us in this WFAA original.
If it has a motor, it has Brady Richard written all over it.
We have Dodge Coronets,
A love for things that move.
Lincoln Zephyrs and Continentals, Buick Skylarks, an old Mercedes. I would say I was born with it.
Often what starts so young stays with us.
6 years old.
Paul Alexander could say that too. In 1952, he suffered a life-changing disease.
Nobody knew anything about polio. Nobody knew what caused it, why.
But this is the story of how two complete strangers met in Dallas.
It was a very unique coincidence.
Come on in.
Unique is an understatement when you know Paul's story.
Yeah, I count myself to be just that, a survivor.
Here, brush your teeth, Paul.
One of likely just 4 people left in the country who live with an iron lung. Kathy is his caretaker.
Everybody should spend a day with them, and it would change their whole perspective in their life.
Paul calls this his yellow submarine.
Oh, you're in there. Yep. I'm in here.
So in pushes in, and out is when you breathe in. It'll be moving back and forth like this.
This machine uses pressure to help Paul breathe after polio took all his muscle control. It is practically extinct. And yet, in a random warehouse with classic cars,
this is probably the most unique thing in my garage.
2 iron lungs, dating back to the 50s, sat in his warehouse and didn't belong to him.
My younger guys were going, hey, what's the smokers for?
It was a year and a half ago that Paul's own yellow submarine started to break down. From where he lays, he frantically started searching.
Everywhere, all over the United States.
He could not survive without it. Other breathing options dwindled.
All the people knew about our lungs were either dead or very old.
Searched the entire country.
Brady?
Only to find help 10 minutes away.
Brady is one of the angels.
I knew I had something to fix that I could fix. You know, I could fix this, yeah.
Not a medical professional, never handled an iron lung, but motors. Brady knows motors, studied every facet of this dead technology.
I understand it now, how's that?
Even has parts from cars to make it work. The iron lung lives on. It functions for Paul like it did when he was young.
I respect this guy for being here. He's just incredible.
Now, just a phone call away, Brady is inspired by Paul's story of survival. We all should be.
What polio did to my life. It destroyed my life. It took everything from me.
It has done all that, and yet he lives happy. It has also brought together 2 men just 10 minutes away.
Please leave your message for 94.
Jobin Paniker, Channel 8 News.
So this man actually, he got polio. He's one of the only ones that are still living in it because it didn't kill him. He became a lawyer. He did like all of these things. He can be outside of the iron lung for a short time, a couple hours, I believe. But the polio is just, it's no joke. It's very serious, but it doesn't happen very much anymore. Okay, so chicken pox. I don't know if you guys have ever had it. I noticed that less and less kids are getting it, but I remember in the 90s they had what's called chicken pox parties where people would bring their kids and they would all, somebody had chicken pox and they'd all get infected so then they could just go on with their life. It's very common and contagious in children. It's caused by the varicella-zoster virus. It can stay dormant in the nerve tissues and can cause shingles later in life. So if you've ever heard of anyone getting shingles like an older adult, it's because it was dormant for a long time. So usually you'd only get the chicken pox once, and it's better when the younger you are, the better, so you can rebound better. So it's not as severe. It is spread through airborne droplets, and it's contagious 2 days before the fever and 5 days after, so for about a week. And you just get your vaccine. So yeah, it doesn't seem to happen as much as it used to. The cold and flu, I know we've all heard of this, the common cold. It's recommended that the adults or the elderly and the medically compromised, so if your immune system is low, get the anti-influenza vaccine, so the flu shot. The common cold is not such a big deal, but the flu is, if it's the true actual flu. We would just treat the symptoms. There's not a whole lot you can do. I know now we have Tamiflu if you were to get that. This is spread through airborne droplets and contaminated objects or direct contact. The flu, the vaccines are successful in 60% of patients. You can be contagious for 12 to 72 hours after you start having flu symptoms. And again, spread through airborne droplets. So everything spread through airborne droplets. The swine flu is highly recommended that the elderly also get vaccinated for this as well. And obviously, if you have a compromised immune system, I mean, we're seeing a pattern here. It says the same thing about all of these. The swine flu, it's called this because it originated from a virus in pigs. Swine is another term for a pig. H1N1 type A is the most concerning because it's evolved into other forms. This is not not preventable with the flu shot, and it does go from person to person. Ebola spreads through bodily fluids from an infected person, is usually fatal. I believe Ebola also causes some pretty serious birth defects as well. So what is the name of the virus that is often seasonal and spreads through the bite of a mosquito? This is West Nile. The West Nile virus. So you'll see a lot of places doing mosquito control. I know there's several companies here in Colorado that test the waters, and then they treat the waters to get rid of mosquito larvae and stuff. So it's kind of nice because Colorado doesn't really have that many mosquitoes, but like for Texas, for example, has quite a few. So I think it also has to do with their the humidity levels, and it's just different. Okay, we're going to talk about herpes as a virus. Herpes 1 is associated with the lips, mouth, and face. So cold sores, stress things, all of those is the virus that's in your system, and it pops up at certain times. Herpes 2 is with the genital area, but can be found in the oral cavity. Viral hepatitis, HIV, AIDS, and herpes simplex are all conditions that are considered high risk. They're extremely contagious and spread by direct contact with a vesicle. So any type of exposed lesion. Some dental offices definitely have their policy in place that if somebody comes in the office with a sore visible or in the oral cavity, that we will not treat them because it is so contagious. So we'll reschedule those and let everything calm down and go away, and then we can treat them. Hepatitis and HIV, these are contracted through blood contaminated body fluids. HIV, well, hepatitis B and HIV are both bloodborne diseases. Brain damage occurs from HIV, dementia. It will develop, or it doesn't always, but it can develop into AIDS. There's no cure yet, but we are working on it. Obviously, there's still very much research being done to figure out a cure for this. Dental assistants are at risk. You should know, I mean, just being at work, you're at risk, but also your high risk behaviors of what will like increase your chances of getting like hepatitis B or HIV or AIDS is being careless with when you're cleaning or, dealing with sharp instruments or contaminated needles, anything like that. You need to make sure that you're, taking extra precautions. You don't want to have lots of sex partners with unprotected sex because you're, again, increasing the odds of being infected with HIV or AIDS. Sharing contaminated needles if you're doing drugs. And then you want to make sure that there's no skin exposure or anything with bodily fluids. So you want to make sure that you're covered when you're at work and that you're not putting yourself in high risk situations. Viral hepatitis is A and E. This is transmitted with personal contact or ingesting it, and there's vaccines available for both of those now. Hepatitis B is a major dental concern because it's transmitted usually through syringes, so you can get it from a contaminated needle stick. You may or may not have symptoms, but this is usually called serum hepatitis. There's an incubation period from 50 to 180 days, so that's quite long. Usually you'll have loss of appetite, abdominal pain, and tenderness, fever, weakness, muscle pain, jaundice, because it's affecting so many different parts of your body. But there are vaccines for that. So if you are offered the hepatitis B vaccine series and you have not taken it yet, I would highly suggest it. It works. It's good to get yourself out of risk for that. So what diseases are the DA at risk if accidentally stuck with a contaminated needle? So definitely AIDS and HIV, hepatitis B. All three of those are bloodborne pathogens. We all know what a pandemic is because we're still living in one. It's a widespread infectious disease. Some of the other pandemics are smallpox, tuberculosis, AIDS. I would imagine polio would probably be in there. I don't know that for sure, but an epidemic is the quick spread, or maybe that was polio. Polio is probably an epidemic, is the quick spread of disease to a large numbers of people. So SARS, and some people are saying, oh, well, COVID is like SARS. And it is in a little bit of a simple way. It stands for the same abbreviation, severe something respiratory syndrome. I forget what the A stands for, but it's very similar. Disease outbreak occurs when a disease effects are more than they initially, expected, but I don't know how you can expect it if it hasn't happened yet. I'm not sure I understand that verbiage, but that's the difference between an epidemic and a pandemic. How does our body keep diseases out? Okay. Infection, fever, inflammation, immunity, and antigens. So obviously all of these things, if our body temperature raises, it's our body's way of trying to kill off whatever it is and make it die. So sometimes you need to let your body have a fever as long as it doesn't get too high or become very dangerous. You need to sometimes let your body do its thing instead of always taking, like ibuprofen to lower the fever, because it's your body's way of fighting it. Might make it last longer if the fever doesn't go away. Your body will then create antigens, inflammation, or signs of infection as well. So again, this is the body's way of getting rid of it. So what is an infection? Pyogenic membrane, it's a dam that's built around the infected area to keep it from going any further. So that takes place. Our body produces antibodies as a final defense to keep it out. The antitoxins neutralize the toxins, are neutralizing toxins that are given off by a certain bacteria. So again, it's trying to neutralize it. It's trying to keep it, contained and learn from it and go in the future. It will fight off infection or pathogens because there's not many bacteria that can survive beyond 102 degrees. So if your temperature gets up high, you can know that your body's doing what it's supposed to be doing. Inflammation will increase. It's a decrease in blood vessels to specific areas, allowing antibodies to enter. So it's flooding your body with antibodies, and that's why it's red and inflamed, is because there's a lot of blood rushing to that area all of a sudden to get more antibodies in there. So all arrhythmia, heat, edema, and swelling, all of these things are signs of inflammation. Your body will then develop an immunity, which is, it's going to be a natural, or there are different forms of immunity. This is the ability to resist diseases. So part of the natural immunity is inflammation in blood. But when we're exposed to a pathogen, they're going to develop acquired immunity. Okay. When you're exposed to a pathogen, they will develop acquired immunity. Natural immunity is what happens with the inflammation and the blood. When an antibody from another person or animal is put into an individual, it's called a passive acquired immunity. And then an active acquired immunity is preferred over a passive because there are two types of active acquired immunity. When given an antigen, the body may overreact. So if there's an allergic response, which we're seeing in the news right now that has happening, this is an allergen. Okay, so some individuals are more sensitive to certain allergens than others, and they're considered hypersensitive, meaning overly sensitive. If they are very sensitive to the antigen, then the body creates a great amount of histamine. So your body's creating too much. And that's when it's called anaphylactic shock, and it definitely can kill you. Usually people, if they have high allergies, they will be carrying an EpiPen. So it's called an antihistamine, meaning it will take away or neutralize the histamines that your body is responding in a way to. So what are the signs of inflammation we talked about? Redness, swelling, heat, and pain. That's your body's way of fighting it. All right, that's the end of chapter 10. So we're all done, and just check your Canvas for your assignments.